Well, over time, people with diabetes may suffer from some serious complications, and one of those is often nerve damage. If it impacts your feet, well, that could leave you with some tough pain to live with. So the experts at OrthoNeuro are here to help.
And Dr. Ralph Napolitano joining me from OrthoNeuro with some advice today regarding diabetics and foot care. So first of all, doctor, thanks for being here.
Thank you very much.
All right, so I want to briefly talk first about the fact that you're a wound specialist before we get into that exactly, because you were the very first in the state to become board certified in it. I think that's important to note. So kind of tell me about the background there.
Sure. So in the world of woundology, if you will, there's a credential called Certified Wound Specialist Physician. I was the first podiatric physician and surgeon to have this certification a few years back.
So when it comes to diabetes, how common are, foot issues, foot wounds when you are diabetic?
Sure, very good question. So one of the big important things we have to look at with our diabetic patient and their feet is the lack of protective sensation. When you lose that protective sensation, you don't know that something's wrong in your shoe or if you step on something. That's when we have trouble. So a wound goes unnoticed, it develops into an infection, and God forbid, something more grave and significant foot loss and or limb and life loss.
So then what are the ways that you can treat these? And I imagine there are varying levels depending on what's going on, correct?
Absolutely. So number one is to prevent the neuropathy to begin with. So controlling sugar is very, very important. So if we keep a normal blood sugar, this will certainly help your nervous system remain healthy, and you'll maintain that protective sensation. Now, in the event that you do lose your protective sensation over time, and it's certainly a significant issue, and we see this in diabetic patients after their disease state progresses, then it's protection. So diabetic shoe gear, regular foot exams by their podiatric physician, general internist, etc. And then preventing things like calluses and bony prominences from rubbing in the shoe, creating an open sore, which opens the gate for infection.
And I find it interesting that you say like shoe fit has a big impact in this. I don't know that people always realize that that can help prevent something. So how do you find the right fit? What are you talking about when you say that?
So at OrthoNeuro, I not only talk about foot health, I talk about shoe health. So getting measured is certainly important. We all probably recall at some point getting measured with that old school Brannock device, which is a slide rule foot measuring device. There's really nothing to replace that as sort of the gold standard. Of course, there's more advanced things like foot scanners, et cetera, but knowing your size is certainly a first step. Feet change like other body parts over the years, so it's important to be cognizant of different changes. So getting your shoes towards the end of the day when the foot tends to be a little bit more swollen in dependency after we've been ambulating. And you want to make sure your shoe fits really very well right out of that box. So it shouldn't be uncomfortable. A little bit of tightness is okay, but if it's uncomfortable, put the shoe back and get something else, or get the same shoe, just a different particular pair, because as things are mass produced, there is variation.
Okay, yeah, that's interesting to note as well. And so when you talk about this to diabetics and you talk about prevention, is it really about, lifestyle when it comes to their disease as much as it is, wearing the appropriate footwear?
Yeah, so you have nature and nurture, and there's arguments therein with both. So maintaining an active lifestyle, healthy feet, I believe, are the foundation for healthy living. So being active, walking, certainly exercise helps maintain that appropriate blood sugar control and overall cardiovascular health. So, and I'd like to point out certainly too that some of these problems unfortunately are inevitable, but it doesn't mean it's a grave situation moving forward. If you have a patient that doesn't have that protective sensation, there are those things that we just talked about that certainly can help preserve life and limb.
That's what I was just going to say, is that when these people then, come into this and maybe have a more serious condition, knowing that there is somebody who can treat this, who can kind of get them back to living as normal as possible, despite the fact that their disease has created this, correct?
Absolutely. Wound care has become a specialty unto itself, and it's interesting in that depending on what hat you wear for your day job per se, you can be a general surgeon that does a lot of wound care. You can be a podiatric physician and surgeon like myself. About 20% of my practice is wound care, both acute and chronic wound care. So it's this multidiscipline approach that's really elevated this specialty into its own.
All right. Well, good to know it is out there, help for people, diabetics and wound care, what we're talking about today when it comes to the feet. So Dr. Napolitano with OrthoNeuro, thank you so much for spending time with us.
Appreciate the time today. Be well. Thank you.